Bismillahirrahmanirrahim. Assalamu alaikum. Today my topic is the hypoglossal nerve, which is the cranial nerve 12. The nucleus of the hypoglossal nerve present within the medulla, and the hypoglossal nerve leaves the ventral surface of the medulla by passing between the inferior olivary nucleus and the pyramid, and leave the skull by passing through the hypoglossal canal and descends downward in the neck and pass between the internal carotid artery and the internal jugular vein and reaches the posterior belly of digastric and give innervation to the intrinsic muscle of the tongue. So here I will discuss about the innervation of the hypoglossal nerve in detail. This is the brain stem, and this is the medullary part of the brain stem, and here is the hypoglossal nucleus of the hypoglossal nerve. So from the hypoglossal nucleus emerges the hypoglossal nerve and leave the medulla and passes through the hypoglossal canal and give innervation to the intrinsic muscle of the tongue and the three extrinsic muscles, which are the genioglossus, hyoglossus and the styloglossus, except the palatoglossus, which is supplied by the vagus nerve. Now I will explain about the ansa cervicalis in relation to the hypoglossal nerve. Hypoglossal nerve emerged from the medulla oblongata, as I told you earlier, and below the medulla oblongata is the spinal cord, and here are three segments of the spinal cord. The hypoglossal canal, hypoglossal nerve give innervation to the intrinsic muscle and three extrinsic muscle of the tongue, and some fibers of the C1 segment of the spinal cord accompany with the hypoglossal nerve and run alongside with the hypoglossal nerve and give innervation to the genioid muscle and the thyroid muscle, and some fibers of the C1 segment of spinal cord descends downward and join with the C2 and C3 fibers of the spinal cord to form the loop-shaped structure known as the ansa cervicalis. And the function of the ansa cervicalis is to give innervation the intrahyoid muscle, except the thyroid, which is already innervated by the C1 fibers of the spinal cord. So here we are done with our the hypoglossal canal and the ansa cervicalis in relation to the hypoglossal nerve. Thank you.